Hello, everyone. It's Friday, July the 17th. Very, very sadly, I've got to tell you that our numbers continue in not the way we want them to continue. We have now lost our 98th, our 99th, and our 100th West Virginian has now died. A 77-year-old male from Wood County, it was our 98th. An 84-year-old male from Jackson County, 99th. And an 84-year-old male from Cabell County, our 100th death in West Virginia. The average age of the people that we have lost thus far is 76 years old. Doesn't mean that our young kids can't get this, and surely can't get it and even transmit it to our elderly. And as you can see today, we have 125 new cases with a daily average rate today, a daily rate of 4.89%. We have 1,450 cases that are active in West Virginia. This is an increase of 79 since Wednesday, and that increase is always calculated by this. You've got people that are getting well, and they're bouncing over from active to recovered. We're taking them off of active and everything, but you can see we're not taking them off as fast as we're getting more and more actives. Today we have 390 active cases in Mont County, by far the highest in our state. And even though our numbers, I always have said over and over that how good our numbers were and everything, and our numbers are still good. I hate more than you'll ever know to look at the number 100 and think that we've lost 100 people in West Virginia. I just go back and say it 1,000 times over, and that is these people have names. These are families, and they have a lot of loved ones and everything, and so please keep them in your thoughts and your prayers. This pandemic across our nation is real, and it is causing a lot of problems and a lot of harm, and so please keep these people in your thoughts and your prayers. In going ahead with the announcement, we continue to test, and we've tested a lot of people now. We've tested 219,000 in West Virginia. In excess of that, almost 220,000. We're 219,947. We have a cumulative rate in the state of West Virginia today that is 2.14. That's a cumulative positive rate from the standpoint of on a national scale. It's a good number, and if you just think back, and I think the number was just the other day in the state of Florida. Florida, and I keep going back to these states like Florida and Texas, and I just want to just tell you just this is Florida's governor, is a very confident younger guy. And Florida was absolutely, the star of the game show. And this guy was out on TV and over and over, our federal government and federal people were calling on him, and he was in all the talk shows, and everything was just hunky-dory and just great. Well, I think the other day in the state of Florida, at the time, that I'm talking about, things were so good in what they were doing, and just think about West Virginia. Things were so good in Florida. Things were so good in West Virginia. It could change. It could really change. It surely changed for Texas, Arizona, South Carolina, Georgia, now Alabama, and Florida right honestly at the top of the food chain. Our cumulative positive number is 2.14, and it's too high right there. And we're losing people, and we're concerned with it. Our daily number, 4.89, is way too high. and we're concerned with it. But Florida's daily positive the other day was at 28%. Absolutely, they were doing great. And this thing has jumped back and bit them in a very, very bad way. I don't want that to happen here. I want to be optimistic about how we can keep everything open and going. I want to be optimistic about our universities and our colleges being able to go back. And I absolutely want to be optimistic about our kids going back. I want to be cautious and I want to be smart. And I want to protect our kids and our youth and everything, and our teachers and our service personnel and on and on. But absolutely, I want in every way for us to keep moving in a really positive way in West Virginia, and I think we can do that. Now, as far as our churches, we have active church outbreaks now reported in Boone, Kanawha, Raleigh, and Taylor counties. Again, we have got to urge those that are going to church and everything to please keep a pew's distance in between. Absolutely wear masks while you're there. And while I'm on the mask thing, I want to clean up one other thing. There are people all across this state that have lung issues or related issues to breathing problems. We accepted that out of our mandate. If you've got a legitimate breathing issue, we absolutely told you that the mask mandatory was not for you. And I would urge businesses to absolutely consider that. You know, I can't dictate to businesses what to do in any way because those businesses are privately owned and they make decisions for themselves. So if you're one of those people and the business decides they don't want anybody in the store or whatever unless they've got a mask on, then you've got to make your own decision. But don't feel harshly towards the business, and know from the governor's standpoint, the governor is saying to you, absolutely, if you have a breathing issue, this mask mandatory, executive order was not for you. Again, I want to urge all those that are attending church. Church is a place where we sing. Church is a place where we're together in a confined area for at least an hour. That's not like outside or walking in a store by people and everything. You're confined in an area for an hour. You're singing, you're projecting your voice and everything. Please wear masks. I want to talk just a second about the small business grants. The applications are open for our small business grant program, and they should be posted on our website. You'll see them right there. Any West Virginia-based small business in existence on February the 29th, 2020, with 1 to 35 employees, and that has to be an employee. If you're one person and you are on a payroll, then you qualify, and we'll be sending you $5,000 as fast as we possibly can, and hopefully we'll be able to even send a few extra dollars on top of all that. And there's no reason to get in this, the biggest hurry in the world, unless your business is really suffering and everything, because this is going to be open until September the 30th. We're still hoping to be able to expand that to those that are sole proprietors that derive their income from the profits of their business, but yet they don't have themselves as an employee per se. We're trying to work through how we prevent as much fraud from happening in any way as we possibly can. And as soon as we get through all that, we'll be able to open up additional to maybe you. The free testing. The free testing this week is in Mercer, Berkeley, Jefferson, and Mont counties, and you'll see it's on the screen. I urge everyone, like I've said all along, please get tested, especially the minorities, especially those that are the vulnerable. But we want We want people that are asymptomatic and just if you've got an anxiety issue, need a test, get a test. We've now sent out 44.5 million and change to 155 cities and counties, and we continue to urge our cities and counties to continue to apply, and we'll just keep pumping money right out to you every day. Our summer feeding program should be up. We have 690 sites. We don't want anybody in West Virginia going hungry, and if you've got an issue and can't figure out what to do, call 211 and we'll help you in any way we possibly can. I want to remind everybody, as I do every day, about the census. Get counted. We need you to be counted, and we need team captains that are on the streets or in the communities to be able to step up and call your neighbors and help me out in that, because I need you right there. Now, before I go any further, I want to talk to you just 1 second about a fellow that was a former state senator, a fellow that lots and lots of people loved and saw, and listened to his beautiful voice and everything. Shirley Love passed away at age 87. It was not a non-COVID related, death, but he was from Oak Hill. He represented the Oak Hill area in the West Virginia legislature for many years. He served in the Senate from 1994 to 2008, and he served in the House in 2016 to 2018. I grew up watching him on TV and listening to his voice and everything, and I know him very well, and I know his family, and I just want to pass on our thoughts and prayers to a great family and a great, great, great West Virginian that we've lost. I want to give you a little bit of an economic, numbers or whatever that have happened in West Virginia since the 1st of July. We went through that last year, and I'm very, very proud, probably the most proud moment that I've had in West Virginia as your governor, by being able to get us through the pandemic year and get us through that without having to lay people off or cut benefits or cut programs and everything, and we did it. And actually we ran across the finish line with a little surplus, and so at the end of the day, that to me is probably the biggest accomplishment that I've been associated with since I've been here. But nevertheless, the good thing on top of that is is by deferring the income tax from April 15th to July 15th, we have Christmas in July, and we were able to get through last year, even with the deferring of that money. You talk about something to really be proud of. That is something right there. We deferred that money. We had the pandemic on top of that and still ran across the finish line in good shape. But here's the thing. So far this year, beginning on July 1st, the personal income tax collections are $192,630,000, and they are $51.17 million ahead of what our estimates are, because we knew these dollars were going to come in July, and we estimated that. And our corporate net income tax collections are $50.13 million ahead of estimates as well. Now, all that's going to change a little bit and get tweaked some and everything, but for the first 17 days of the month, we're excited, we're happy, and we're excited. So we're moving again, and we're moving in the right direction. There's no point in me going through the charts with you. It's easy to see that. Let me go through it real quick. The first chart, the first thing, if you'll just look, those lines continue to move the way we don't want them to move. And down in the next line, you can see that big bump up and everything. That says 4.89, positives, on a daily basis. We don't want that, for crying out loud. And you'll see that on the bottom, our cumulative continues to rise. It's 2.14. Absolutely, I believe, and I believe this with all in me, I believe if we can make it another 10 days or so, maybe 14 days, it could be even longer than that, but 10 or 14 days and everything, I'm very, very hopeful that we're going to start to see these numbers start to get a little bit better and everything. And but here's the $64 question, and then I'll be quiet. It's one thing and only one thing. If what's happening in the states that I talk about over and over, Texas or Arizona or Florida or now Alabama, Georgia, South Carolina, if that continues to move and it moves to West Virginia, we're going to have big problems. And these numbers are going to just get worse and worse and worse. Naturally, the better the job that we do in wearing our mask and trying to look after ourselves and our neighbor, the better off we'll be. And, and we want to absolutely follow all kinds of guidelines and everything. The CDC, which I proudly say this, the Alabamas, the CDCs, Walmarts, all kinds of people, they followed us. We want to be the ones that are getting out ahead of things, and I ask you to keep all people in your thoughts and prayers, but I want everybody to hear me just say just this. The secret to everything that has been accomplished, and it's you, West Virginia. It's not me. It's not all the medical experts. We come up with guidelines and ideas, but you have got to put them in motion. And you've done that. In West Virginia, you have pitched almost a perfect game. We've lost 100 West Virginians, and that's terrible. But the states around us have lost many multiples of that. And absolutely, though, West Virginia, you have been the miracle. You, West Virginia, have done it. And I could never, no matter what anybody ever says, don't let anybody take away your effort. I know it's been inconvenient, and I know it's been tough. It's been economically tough. It's been tough on the kids. It's been tough on tough and tough. But West Virginia, you've done it, and I'm proud of you.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good almost afternoon, everyone. I want to catch everybody up on what's going on around the world, around the country, and then in West Virginia in a relatively quick way. So we know that coronavirus is spreading very rapidly around the world. In the last week or so, we had a 5-day stretch in which there was 1 million new people that were diagnosed with COVID-19 around the world. And certainly in Latin America, things are spreading very quickly. And we're seeing areas of the world that are now getting affected by COVID in a really substantial way. India just went over 1 million cases as well. When we look at our country, we had the single highest day COVID-19 new cases testing positive than we've had in the entirety of the pandemic. We had almost 80,000 people. In fact, specifically around 77,000 people test positive for COVID-19. And we also set a single day record in the number of deaths. We approached 1,000 deaths yesterday from COVID-19. And on a proportional basis, Florida leads the country in the per capita cases. And if you follow the curve of Florida, as the governor pointed out, and you follow the curve of New York, and Florida at a population level and New York are relatively similar. Florida, about 19 million people, New York, about 21 million people. But if you look at the curves at the time that you could sort of match how things are growing, Florida is actually looks worse at this point than New York did. And as we start to look back on what happened to New York when they surged and had all the problem with having their hospital systems overwhelmed, we know today that most of the hospitals in Florida are down to single-digit numbers of ICU beds. And in fact, if we look across the country, as the governor has mentioned, and we look at Texas and Arizona, they have now basically requested and have on site refrigerated mortuaries to be able to handle the additional people dying there because their morgues are overwhelmed. So we see this happening, and we know this is actually happening from from younger people in Florida. My understanding is the average age of positivity is 38 years old. And so as we look then at a recent study that came out from University of California, San Francisco, we've seen a 300% increase since April in the number of young people, 18 to 25-year-olds, that are hospitalized. So there's a narrative out there to say, wow, young people might get it, but they're fine, they're safe. That's actually not true. And the single most important risk factor for being hospitalized in these young people is cigarette smoking or electronic cigarette smoking. And so we know in West Virginia, we've had a problem with minors smoking and young people smoking. And so that puts West Virginians at a particular increased risk for this. And as the governor said, our RT value continues to be very high nationally. We are third worst in the country today. And over the last week or so, we have been anywhere between 1 and 4 worst in the country, which means that COVID-19 is spreading. The number today, I believe, is 1.32. So ultimately, what we need to do is we need to continue in a very disciplined way, as we've done in the past, to be able to reduce that number. And the way that we were able to do that is to really embrace what the governor has led us to do, which is to wear our mask and stay physically distanced from each other and protect ourselves, because by doing that, we protect each other. And we know now, as we look at the data in West Virginia, we have seen a substantial increase in our cumulative positive rate the governor has articulated. And we know when it goes over 3%, that becomes really difficult to contact trace. And so we really need to start pushing that number back down. As we look at our daily positive, that is far too high. And so this is really a time in which the kind of mitigation measures that the governor has put in place really need to be embraced by our citizenry. And if we do that effectively, we'll see that impact over the next week or 2 weeks. And we also know that hospitalizations will start to increase over the next week, as we've seen our cases go up predictably. And over the next 2 to 3 weeks, we'll see people who will get sicker and start to die of COVID-19. So right now is the time that we really need to act, and we really need to work as a state, work together, great community, altruism, wear your mask, protect each other from having people who don't know they have the virus yet from spreading it. And to that end, there's been some reports recently about the testimony that a number of us did in the House chambers on last Monday, and that a person who was at that meeting tested positive for COVID-19. And the good news is we've worked with Sherry Young and the Kanawha Charleston Health Department, as well as with Dr. Amjad and others, that what we found was, because this person was wearing a mask in that circumstance and people remained physically distanced, that the risk to anybody there was really minimized. And so that was a great illustration and example of an opportunity where many people could have been, seriously exposed to COVID-19, but because of the forethought and the altruism of the people in that meeting, by wearing a mask and staying distant from each other, that we were able to minimize that risk of spread. So West Virginia, as the governor has implored, and I would join his request, it is the time for us to really double down to protect ourselves and each other. If we don't do things in the right way, we will start to see more hospitalizations. We'll start to see more people in the ICU. We'll start to see more people dying of COVID-19 in West Virginia. And we'll start to see more young people that will be suffering that fate as well. And that is what we can't afford to do. And that is what we have the ability to prevent from happening. So thank you so much. And please be very diligent in the following days. Thank you.
Governor?
Okay, I've got something here, because I've each and every day, and I really do enjoy talking to people and listening to their concerns and everything. And I really think that it's really, really important that we get the proper and absolute most accurate data. I've had people call me and say to me, you know that 99.93% of the people that get this disease don't die. Now I'm gonna pass these back and forth to Dr. Marsh, and I want him to answer them quickly, but I think that is in total error. That 99.93% of the people that contact this disease they don't die. Is that right or wrong, Dr. Marsh?
That is correct. We know that the mortality rate across the world with COVID-19 right now is about 4%.
So this is not correct. You know, what I'm saying is people are saying that if I get this, 99.93% of the people don't die. Now, are you saying that that's true or untrue?
That is absolutely untrue.
One more time. What?
That is absolutely untrue and inaccurate.
Okay. And so, also, I'm getting people that are saying this is just like the flu. And if I get this, I'm not going to have any more danger probably than just like the flu. True or untrue?
That is untrue. The flu has a mortality rate at the most of 0.1%. And the long-term manifestations we're seeing even today with brain functioning and other problems, and even in people that can get better from COVID, are substantial, much, much worse than the flu.
Okay. Now, West Virginia, I'm not a doctor. I'm not a medical expert. These people are great at what they do. And I listen to them. I listen to them all the time. West Virginia, you've got to understand you are the oldest state. You are the most chronically ill state. And you are located right in the hot spot. Now, you've done great. You've done great in every way. I've asked you and made it mandatory that you wear a mask. I don't like that. I don't like the mask. But I am telling you, that's the only bullet in the gun that we've got right now to protect us. The idea that you've got a 99.93 chance of survival if you get this is not true. The other thing is, I think this thing, as far as the death rate, has got in excess of 20 times greater than if you had the flu. Absolutely, West Virginia, it is real stuff. Now, that's the negative side. The positive side is just this. By doing what you have done, West Virginia, you have absolutely become the miracle. I don't want anything shut down. I absolutely want everything going. We can have everything going. And we've got to put up with the inconvenience of the mask. And absolutely, that's just all there is to it. But at the end date, if this thing doesn't sweep from the south all across us and everything like it's doing, and we are really smart about what we're doing, we're going to be able to enjoy all the stuff that you're enjoying right today and keep everything open, have the economic numbers working, have people have jobs and opportunities, and in no time, we hope and pray, we're going to have a vaccine. Don't believe these myths that people come up with because they're not right. They're just plain not right. But West Virginia, you're doing great. You keep doing great. We keep everything running, and we make our way. For a few more months, we'll make our way to a vaccine. And then when we're there, we're home free. And then we tell the world over and over what the miracle that happened in West Virginia was and what you did. You did, West Virginia. So all I wanted to do was kind of clean that up and clarify that. Thank you, Dr. Marsh, and thank you, West Virginia, again.
All right, next we'll go to Dr. Ayn Amjad, our State Health Officer.
Good afternoon. I would like to start out by saying that my heart goes out to all 100 families that have lost someone to COVID-19. And while there's a lot of people who will say, 100 people are not a lot compared to other numbers, I'd like to remind everyone that each one of those people do have family members and that one person is still someone. And so we'd like to remember that. In addition, we did have a House of Delegate employee or person in the House recently that was tested for COVID-19 and that had a positive result. And we'd like to wish them a speedy recovery and that hopefully they don't become very sick. In addition to that, we'd like to thank everyone in the West Virginia Public Health Department and all of our help out there, especially the National Guard who's been helping us with COVID-19. They've been doing a lot of work these last few months. In addition, we had an employee today who's been working for 41 years who's retiring. His name is Gary Thompson. This morning, we had a little bit of a meeting to say goodbye to him. He's been in our department for 41 years. He was working for over 25 years in the Vital Statistics Department. I only got to spend a week with him this past week, but his name is Gary Thompson, and he worked with the Bureau for over 41 years, which is very impressive. Regarding the face coverings mandate that Governor Justice and Clay Marsh was referring to, we want to remind everyone as well that, if you cannot tolerate wearing a mask or a face covering, we have other options. A lot of people refer to the mask and how uncomfortable it is, but you have gaiters to wear. You can wear a bandana. There are other options of things to cover your face. And as the governor mentioned, if you can't, you can ask businesses what other things you can use, because everyone saw this week that Walmart is mandating or making you wear a mask. Obviously, if you cannot, you can also have a conversation with the manager of what your options are. I spoke with a pastor here in Beckley. She was talking about holding conversations with other church leaders in the state of how we can address the issue. We are not trying to stop people from attending churches or having gatherings. We believe in freedom of religion, freedom of choice, freedom of expression, but our job here is to keep West Virginia safe, keep everyone in the state healthy. Having people wear face coverings is our only way to keep everyone safe right now, as the governor mentioned. So that is our only way to do this, and that's what we're asking everyone to do. But we want to continue having conversations. That's our goal here. Speaking with people is the way to do it. Using social media platforms sometimes causes anger. That is not the best educational tool. We want people to speak in person and continue having these conversations. That is our goal here. And face coverings, there are many options to use if you cannot tolerate a mask. If anyone has any questions, they can direct that towards the Bureau for Public Health or anyone of us up here. And I'll leave it at that. And if anyone else has anything, they can direct it towards the group. Thank you.
Thank you, Dr. Amjad. Secretary Crouch had a previously scheduled engagement today, but he will be with us again on Monday. Next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. A significant amount of testing support going on Mont, Berkeley, and Jefferson counties, as well as some rapid response support at the state capitol with the House of Delegates. We're also supporting Charleston Police Department with some testing and some sanitization support. I want to thank Dr. Young and Monica Mason from Kanawha County for their support to work those initiatives at the House of Delegates and support us with Charleston PD where needed. Want to also talk about PPE for just a moment. PPE rates over the last cycle have increased in our hospitals and our long-term care facilities about 4%. So we're seeing some increase in PPE use. We are doing exceptionally well right now based on the task force that we were directed to establish by Governor Justice with maintaining supplies of PPE, and are continuing to work aggressively to get to a 180-day supply where possible based on availability. As mentioned by the governor, Dr. Amjad, and Dr. Marsh, retailers are now requiring face coverings. We are having face coverings as a result of the mandate and the need to do it. I want to reinforce, we talk with the retailers on a daily basis about a variety of issues, and one of the things that they've asked us to reinforce, that the governor reinforced in the last press event, is retailers are making a variety of other options available for those who can't wear face coverings or who have difficulty going into facilities. So curbside pickup, other types of options. Please reach out to your retailers if you have an issue and look for opportunities there. Last two things I leave you with: over the past 2 days, West Virginia National Guard, the governor and I have been excited to welcome back all the members of the 130th Airlift Wing who've been deployed over the past several months. We tested all of our service members as they came back in, and fortunately all tested negative and they are back with their families. And then I want to also point out that tomorrow will make the year anniversary from the loss of Sergeant Billy Freeze, a member of the West Virginia National Guard who died in Kuwait due to non-combat death. And we want to express our condolences and appreciation to his family and send them out our love and our thoughts and prayers, and to all of our Gold Star families. Thank you.
Thank you, General. We'll now go to questions from members of the media. The first today is from Kenny Bass with WCHS and Fox 11.
Thank you. This is Kenny Bass with Channel 8 and Fox 11. I have a question for the governor about a lot of talk about the legislature. I've been doing some research, and it doesn't show that legislatures across the country have been particularly active in distributing CARES Act funding. Mississippi allocated some CARES Act funding from its legislature, but most of the legislative actions I've found through the National Conference of State Legislatures were from legislatures that moved around general fund or budgeted money which already existed that didn't come from the CARES Act. So I know that you've been questioned about this before, Governor. I just wondered if, outside of the reasonings that you've given, which are political and are being motivated by things other than sincere efforts to help distribute the CARES Act, what other reasonings do you have to where bringing the legislature into special session, besides expenses, would be an impediment or a hurdle to what you're trying to do with getting the money out as quickly as possible?
Kenny, it's a great question. It's a long question, and it's got a lot of little tentacles along with it. I'll try to answer it as best I possibly can. First and foremost, I want everyone to know that I have been the architect in coming up with how I think the distribution of the CARES dollars should be. But right behind that, you have all these grants that are right, for all practical purposes, equivalent to the total amount of CARES dollars that I don't have anything to do with any of the administering or those monies going out. Now, so just stay with me on this. From my standpoint, if you'll look at how I have set up for the CARES money to go out, first of all, I feel like that falls under my bailiwick in the fact that, in the state of emergency that we're in, that's what I'm supposed to do. Now, I have been an architect, but I want everyone to know how those monies are administered. There is no pet projects. There is surely no dollars in any way coming to me. I really don't care how those monies are administered, except I think we have come up with the very best plan that we can come up with. Now, let me tell you this, and this is all there is to it. When I walked in the door, financially, we were in real trouble in West Virginia, and you trusted me. And we built record surplus after record surplus. In the year that we just came through, you trusted me again. from July 1 a year ago to June the 30th that we just finished, you trusted me. We went through that year, and in April we had a $192 million deficit. Actually, 198. And everybody said, where are we going to turn? What are we going to do? And there was cries all over the place. We got to go into special session, and we've got to raid the rainy day fund. And we've absolutely got to do that right now. And I knew better. And I said, we don't have to do that. And we kept watching the numbers and watching the numbers, and lo and behold, not to say, anything except just the truth, but I was right. We didn't have to bring people back and spend money. We absolutely didn't have to do that unnecessarily. We absolutely shepherded our way through, and lo and behold, we ran across the finish line with a surplus. If you go back to February, we had a pandemic on our hands, and we had to make the right decisions and push the right buttons and get us through the pandemic. And you were kind enough to trust me, and you were kind enough to listen, and you knocked it out of the park, West Virginia. Now you have a situation, and I can't call it anything except exactly what it is. Again, I have set up a task force of representatives from the Democrats and the Republicans on the House side and on the Senate side. We convened about 4 weeks ago with the plan that I had. And I put it out there, and I said, the suggestion box is wide open. Anybody that comes up, any House member, anybody that comes up with it, direct them to the leadership and then bring them to me. Now, I didn't hear squat. For all practical purposes, almost zero recommendations or suggestions. The reason for that, it's a good plan. But the suggestion box was wide open. So you had a plan on the table. It was a plan put together by the revenue experts of this state and myself, and it was a good plan. And then you had a suggestion box that was open and said, send me any suggestions you want to have. Testimony to that is just this. The Senate just recently came to me, and they came to me with a tweak that was a major tweak for broadband. Broadband in our state of how we could do that. And we did it. We did it. We pulled money out of highways and put money over toward broadband. Prior to that, there were people that came to me and said, on the 5 to 35 limit on the small businesses, can we not go all the way down to 1? And we did it through the suggestion box. And now what you've got is just this. I can't say it any more bluntly than just this. Now you've got a bunch of people in an election year that want to turn this thing into a circus. Turn it into a situation, and the majority, in all honesty, the majority has everything to lose, and the minority has nothing to lose. I am here for West Virginians. I am here for all West Virginians. Whether you be in the majority or the minority, I am here for all West Virginians. But let me give you a shining example of what I'm talking about. If I'm in the minority, the Democrats today, I stand up and say, what I would like to do is pass a bill that says we're going to send $2,000 to every adult human in West Virginia. And the majority, which is the Republicans, they say, we can't do that. And so they vote no. What happens? What happens? And here's exactly what happens is you've got a bunch of what I would call outcasts or oddballs that are running this scenario from the standpoint of the Republican side, and if they don't watch out, they're going to gut their entire party. Now, so what I say is just this. I say there are people dying here. Absolutely, I I will never in any way, I do not want to be a king. I do not want to be any way whatsoever a dictator of anything. I don't care how the monies are spent. I don't care except for one thing. I want it to be the best job that we can do. I want us to take every suggestion, every idea, mold it, let it be fluid, let it work. But I don't want this terrible epidemic that's taken 100 of our West Virginians to turn into a soapbox political campaign, absolutely, with us throwing rocks back and forth at one another. That is not what we need to do today. From the standpoint, if they want to call themselves back in, let them call themselves back in, and I'll sit on the sidelines and watch. I'll gladly do that, but I'm not going to help them. I'm not going to help them do something else that is detrimental to them. I'm not going to help them do something that is detrimental in what I think to our people. The last thing I'll say, it's a three-prong approach. There was a great idea that was put together by our revenue people. The second thing is the suggestion box has been open and continues to be open and is welcoming every single comment. And the last thing is, when we come back, it's going to cost you, West Virginians, $35,000 a day to watch the circus. And not only that, we yesterday had a positive test of an individual that was, in contact with many of the house people, and she was protecting herself and protecting others, wearing a mask, and we hope and pray by the tests that are being run that didn't get transmitted to a bunch of people. What would happen? What would have happened if in April I would have called everybody and I would have listened to the cries and called everybody in here and said, we've got to invade our rating day fund, when we didn't have to do it. But in April, if we'd have called everybody back in here and everything, think of the level of potential exposure to people. Think of the cost. We didn't have to do it. We ran across the finish line with a surplus. In this situation right here, the suggestion box is open. The idea is on the table. Absolutely, West Virginia, I am doing everything in my power in any way I possibly can to help West Virginians. And that's what I'm going to continue to do. If we want to do it in a different way, more power to us. But absolutely, I'm not going to sit idly by and watch us, self-destruct and blow ourselves up.
All right, thank you, Kenny. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Sorry, wasn't expecting to get called on. Considering we're probably recovering from a peak caused by some of the Memorial Day weekend activities, can we anticipate going into another peak as we see cases ramp up from July 4th weekend activities?
Well, Phil, first of all, and I'll have to defer to our medical experts, but I think it's awfully peculiar that we could be seeing a peak now come from Memorial Day, because Memorial Day, 14 days from Memorial Day is when we should have seen the last hit from that. And if I remember correctly, Memorial Day was like the 26th or something like that of May. And so, but Phil, to more directly answer your question about, things that could be happening in regard to the July 4th, we started seeing this, and if you'll remember the Thursday before the July 4th weekend, that's when I came to you and said, we got to get ready, people. We got to get ready, West Virginia. You got to get your mask. It was a notification period to our businesses and everything else, but we saw it coming, and we saw it coming right then. We saw things, starting to look like that we could have a reason to have a lot of concern. We wanted to watch the numbers over the weekend and everything. The numbers on Monday after the 4th of July weekend were already numbers that we didn't want to have. And so this really this really started really probably a week before the 4th of July, or maybe just 4 or 5 days before the 4th of July. But anyway, Dr. Marsh or Dr. Amjad, maybe y'all can add to that.
Maybe I'll start real briefly. Governor, I think you're exactly right. We would expect that between 1 and 2 weeks, depending on who is doing the test, just because of some intrinsic delays in the return of tests from some of the big national testing laboratories. But we would expect to see the cases from Memorial Day back in the past. Phil, I think that the answer to your question is that we are seeing more community spread. We're seeing it among younger people in the state, and particularly in certain areas of the state. So it's really, I think, even more important what the governor has done with the mask mandate. But Ain, I'll turn it back to you, Ryan.
Phil, yes, we are concerned, especially with the July 4th holiday, with people traveling. And that has to do with also, people who have been home, they've been bored, they're traveling with their families. A lot of people want to get in a vacation before potentially school starting and those types of events. But definitely with any holiday, people are outside more. They want to be outside with their families. They're going even with boating and things like that. And of course, if you're indoors with face covering, that's one thing. But when people are outside, it's still hard to socially distance themselves. They're getting in still large gatherings. So we want to encourage you that even if you're outside and you're not wearing a mask or a face covering, you need to stay within your family circles and still socially distance if you're outside doing any events. We know in Mont County, people are going out to, I think it's Cheat Lake and things like that. But you need to still socially distance yourself and stay within your family circles, because that's where you still have community spread and what we're seeing. And also we know when people are going out to beaches and events like that, it's hard to breathe with a mask or a face covering when you're outside. It's too hot. But that's why you need to socially distance and stay within your family circle to avoid a community spread. But any holiday event is concerning because that's when we're seeing this happen. So that there's definitely truth to that.
All right, thank you, Phil. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. Governor, you've been talking about attempted unemployment fraud for a couple months now. On this side of the Potomac, Governor Larry Hogan this week said they had a case where they found 47,000 illegitimate claims and over $500 million in attempted fraud, and that other states may have been involved in such a hack. Have you seen any of that in West Virginia? And maybe as a follow-up, as part of the main question, have you lost any money to fraud through unemployment through this COVID-19 pandemic?
Paul, I am positive that we've had to have lost some money. I'm also positive that we absolutely were able to step in and stop potential fraud that we caught and everything. Everybody's always got a game, and everybody's always going to try to circumvent the law, and so we've got a great director in Scott Atkins, and a lot of people from the Guard, and a lot of people that are really working this, and they work at night and day, and they watch, and they follow up, and they do everything that they can possibly do, to stay on top of it. That's one of the reasons that it's taken us a little bit of extra time on these business grants, these small business grants, and getting them out and everything. But there is also a component that is out there at play that we're watching that is an international organized crime, because there's absolutely a feeding ground for all kinds of bad and wrong activities, and our people and the Guard and all of our law enforcement and everybody's watching as best we possibly can. We're catching stuff and stopping it, but Paul, it's a problem, and that's really what's slowing us down a little bit on these small business loans as well, or grants rather.
All right, thank you, Paul. Next, we'll go to David Beard with the Dominion Post.
Hi. We've said today that the virus is spreading in states all around us. Here in West Virginia, we're looking at 10 to 14 days before we see any effects of our mask order. But we're also looking at seeing more people get sick and die in the next 2 to 3 weeks. So from that, I have a two-part question. First part would be, do we need to maybe consider reinstituting some kind of travel ban or a mandatory quarantine on travelers coming in? And the second part would be, I know we're being optimistic, but how practical will it be to have thousands of people come flooding back into Morgantown and Huntington right at the edge of that window that we've talked about? Thanks.
Our medical experts, y'all chime in after I get through here and everything on anything that I'd missed. But David, we're really concerned. I met with the WVU people on Wednesday. I met with the private colleges and some other people today. I'm listening to all kinds of plans that everybody has to be able to assure that we're going to be able to keep our students and keep our faculty and everything safe. There's a lot of great work that's going on right now by the universities and colleges across this great state, and they're absolutely going to be ready. But at the same time, I've told them over and over, we have got to continue to just watch what's going on. I just got through saying exactly this, that last Friday, 7 days ago, things were surely different than they are today. 7 days from today, we'll know more than we know today. We're on the eve of kids coming back. One of the things that was brought up by Sarah Tucker today was just this. Sarah said to me, she said, should we move now to making it mandatory that any kid coming back to a school from out of state be tested? Because about half of the schools and the universities are being able to do that right now. I think WVU is testing everybody, and they're doing it very well. Appalachian Bible College is saying, that people coming in, they're going to quarantine people for 14 days before they put them back out into everything that they're doing. And so there's all kinds of different things that are happening, and they're happening right now. But absolutely, I said, without any question, we're going to test every single kid that comes into West Virginia from out of state, and we're going to do that now. As far as the travel bans and so on like that, our health community and everything is looking at that, and they advise me right along on what to do there and everything. That becomes more difficult and everything, but David, we're absolutely, on top of this and meeting, and the colleges and the universities have done a heck of a job and everything, but we still got to really watch, because we'll know a whole lot more 7 days from today than what we know today.
All right, thank you, David. Next, we'll go to Mark Curtis with Next Star Media.
Good afternoon, Governor and staff. First of all, Governor, I want to thank you for your kind words about Shirley Love. He wasn't just a newsmaker to many of us in the business. He was a dear friend and a role model for how we conduct ourselves in the broadcasting and journalism business. So God bless Shirley, and thank you for your kind words. My question today is kind of a follow-up to David Beard's question. As I understand it, the three counties with the biggest spikes now in West Virginia are Monongalia County, Kanawha County, and Cabell County, three counties that have significant populations of college-age students. Given what you just said about the colleges, is there any thought to shutting down the bars also in Kanawha and Cabell counties in advance of students coming back to prevent, and I realize that summer school right now, there are not that many people here, most classes online, but still these three counties have a significant amount of young people who are going out to bars.
Mark, I'd say the smart money for all of us is to keep everything on the table and to continue to watch the numbers and absolutely know that all of this is still at play. Right now, our biggest hot spot and our biggest problem with is Mont County, where we've got all those that I just named earlier. I think 390 are right at 400 people that are active cases, and the overwhelming majority of those was in an age group from 18 to 28 or 9 years old. And so we got to just watch it. We got to stay on top of it in every way, and that's what we'll do.
All right, thank you, Mark. We have time for one more. We'll go to Charles Young with WV News.
Hi, this is Charles Young with WB News. My question is regarding the staff member in the House who tested positive. In the statement that Speaker Hanshaw put out yesterday, he said, even though employees were required to social distance, wear face masks, anyone present at the meeting is asked to quarantine, be tested, and monitor for symptoms. So given the fact that all the members of the task force were there, are you all quarantining? Have you been tested? And could you talk about any contact that you had with the governor after that meeting? Did any of you all meet with him in person? And if so, are you taking the same steps, Governor?
Well, I've been tested multiple times, and if you said, am I taking the same test? I'm sure that all of us are following guidelines and everything to where that all of us, that are meeting with me, are wearing masks, doing all the stuff that they're supposed to be doing, and all of us are going to follow exactly the protocol that has already been laid out.
All right, Governor.
The other thing I'd add is General Hoyer and Dr. March both ought to weigh in on this, because they know exactly what is going on with the testing that is happening right as we speak. Charles, they can help better than I.
So to answer your question related to myself, I have been tested negative. I wore a face covering the entire time, actually a face covering with a Gore-Tex face on it, so it provided more protection than normal. The National Guard was directed by the governor to support the initiative this morning with testing House of Delegate staff and members available. Kanawha County Health and Kanawha County Emergency folks have supported that effort, and the testing is ongoing as we speak right now. I did not have direct contact with the governor. I've been in contact with the governor on a regular basis by phone and by Zoom calls, but not direct contact.
And I would just add very briefly that Sherry Young at the Kanawha Charleston Health Department has done an extensive contact trace and didn't feel that with the mask worn and the distancing that those of us on the call and I believe most other people in the meeting during that time did not have substantial contact that would have put us at high risk. We all wore masks, but like the general, I also have been tested and I tested negative. I think it just reinforces the idea, though, that wearing masks are so important, because for many people, they don't know they're infected when they can infect other people. And the mask wearing and the distancing so much reduces the risk of spread that that's an important mitigation measure that we see illustrated very clearly here.
Governor, I'll turn it back to you.
The only thing I would add back, Charles, is I was tested and tested negative as well. So I guess to just wrap it up, I would just again say, we've covered a lot of data, and I've given you a lot of information in West Virginia today. I can never, ever say it enough. You've done a heck of a job. Stay the course. Absolutely continue to be the miracle that you've been over and over. Absolutely don't fall prey to believing that a 99.93% possibility that you're not going to have any problem with this issue. This is absolutely significantly more than the flu, and we've got to deal with it. We just plain have to deal with it. You're doing a great job, West Virginia. Stay on top of it. We're surely going to get through all the issues of the legislature and all that. I have said to you over and over, as far as how these dollars are spent, I want them spent in the very best way we can spend them, but I don't have a pet project. I don't want to be your king. I want to be your governor. I want to be your governor that drives his own car and doesn't want a thing in the world and just does the right thing for you. Thank you, West Virginia, for all you've done for me. God bless you.